Hi everyone, I'm presenting this project on behalf of myself and my co-authors. Our paper is called Beyond the Bulging Binder, Family-Centered Design of a Digital Health Information Management System for Caregivers of Children Living with Health Complexity. Jane is a child living with health complexity, or CLHC. These children are usually defined by having one or more chronic conditions. They only make up less than 1% of the pediatric population and can account for up to 50% of the acute care costs. This population is also one of the fastest growing due to the advances in pediatric care. These children rely on an average of 13 care providers, usually require technology assistance, and could have substantial use of family resources for their care. The number of stakeholders and disjointed health records complicates stakeholder communication. When we add in life-scale timespans, we are dealing with a large, disparate volume of health records and information. Susan, Jane's mother, is a parent caregiver. She often has a dual role. She is both a parent and a care coordinator. She also needs to manage these huge masses of paper health records and decentralized electronic records. As a central information holder, she has to repeat their family's story to different and unfamiliar care providers over and over again. Susan is stressed out and exhausted from the burden of being a care coordinator. She wonders why technology cannot help with managing Jane's health records. This figure depicts the relationship between costs for simple, complicated, and complex health conditions. Designing systems for complex conditions and solving their challenges could provide design solutions for complicated or simple conditions. Existing tools and technologies fail to adequately encompass all the aspects of caring for CLHC and their information management challenges. For example, there are many specialized purpose tools and also novel interface such as voice-assistive technologies. A vast area of HCI literature is focused on personal health tracking systems which often have a narrow foci and cannot accommodate for the complexity of tracking that caregivers are looking for. Technology is undoubtedly one solution to the problem, and recent advances have focused on creating centralized database systems. In the near future, paper health records could all be digitalized and barriers to access could be removed. Previous research has focused on solutions with a narrow focus and do not directly address complex information challenges. We wanted to go further in this work, and with a futuristic vision, identify what these parents want or need to do with information, and how a user-facing interface for information management could look, and whether we can identify design principles to tailor solutions. This study had three iterative design phases. Overall, we conducted three user studies and three subsequent prototype design activities. During all three phases, we interviewed parent caregivers from 12 families. In the explore phase, we wanted to gain a better understanding of the problem space and foreseeable future changes, so we interviewed two domain experts and reviewed the existing literature. In the conceptualize phase, we aimed to obtain a high-level understanding of how the user interface should work, so we conducted interviews with 5 parent participants to understand their main challenges and strategies in managing health information and analyze the data using thematic analysis. In the refine phase, input from preceding phases informed our medium-fidelity prototype. We collected feedback on our design from 4 parents and then finalized the prototype and devised a set of design principles. Throughout the phases, we also collected information about participant preferred features and analyzed the data to create a feature ranking. In total, we talked with 12 parent participants. Our interviews with parents identified these caregiver-centered information challenges, which also corroborate previous research. Parents told us that accessing information is limited and they need to go through different systems, that it is hard and time-consuming to find information about resources, and that managing financial information is a full-time job because there is a lot of spending. Parents express a deep desire to humanize their child and show care providers what their child is like outside of the care system. Parents usually become the central information holder and need to coordinate communication between the stakeholders and constantly be in the picture to ensure holistic care for their child. Navigating the healthcare system is challenging because it is hard to know how to communicate with stakeholders and what information they need to see. What follows are the design principles that were derived from our data. It is very clear that the best strategies caregivers have found cannot make their challenges with managing health information any easier. So an information system aiming to improve their situation needs to save time, reduce errors, lower the need to remember information, and create a streamlined communication with stakeholders. Based on these needs and through the process of user-centered design, we devised a set of design principles for CLHC caregivers. First, integrate information for a holistic provider spanning view. Prioritize communication and collaboration in underlying structure. Capture history and provide insight across many personalized parameters. Humanize the child and the family. Build in customizability and flexibility. And allow easy access and share confidentially. Based on these design principles, we began to build a conceptual model for a prototype. This image shows the first iteration of the conceptual model. The conceptual model helps to connect all the various parts of the prototype. A more structured version of the conceptual model starts from the dashboard and connects to important pages for the child's profile, medical timeline, calendar, care plans, and care team. The image on the left shows our design for the main dashboard with a list of upcoming tasks at the top. Here we see the overall and complete version of the conceptual model with additional nodes added. This is basically a map of the prototype which follows an ecosystem approach. An example of how we might meet our first design principle, integrating information to provide holistic care, is to enable bookmarking information on each page and integrating information through generating summaries based on the bookmarked information. The principle is to facilitate communication and collaborate with and between stakeholders. These panels show our implementation of a care team page, where the left panel is the dashboard. The parent can add action items for the team and ask questions on the QA board. To implement the third design principle, capturing history and providing insight, the interface should maintain an accurate and historical record of events and provide access and insight into the family's health data through caregiver-centered visualizations. Finding symptom patterns and overlaps between multiple events can be very helpful to facilitate communication with care providers and empower parents. These images show our implementation of a medical timeline and a corresponding graph preview for each tracked variable. These graphs and visualizations allow users to find trends. For example, they can track whether a certain medication worsens symptoms or alleviates them. The fourth design principle is to humanize the child and family. These panels show our implementation of blog-style pages to record the child's life at home and school, and to record the way they communicate through gestures, postures, and expressions. This information is important to share with secondary caregivers, nurses, school or respite services. This can also help care providers to make better care decisions and become familiar with the child's daily environment. The fifth design principle is to customize and allow flexibility. Parents would like to have flexibility with how they organize information, so adding options to add custom data categories is important. Another example of customization is being able to set reminders or having downloading and printing features. The final design principle is to share and access confidentially. Parents have all rated the ability to share information very highly, but confidentially. They want to share information without having to fill in and sign numerous forms to provide consent. To conclude, the contributions of our work are a deepened understanding of information-centered challenges and strategies of CLHC caregivers, which match previous research and can guide task-based solutions. For example, the need to humanize the child and family is very important and less talked about. A set of caregiver-centered design principles targeting health information management. For example, integrating information to provide a holistic and provider-spanning view should be a key component of future designs. A blueprint in the form of a prototype for caregiver-centered interface, which illustrates a way to implement these design principles, is also one of our contributions. Thank you for listening.